Okay, this is my patient Priya today, and she has upper back pain, shoulder pain in the trapezius muscles and supraspinatus going into the neck. She also gets migraine headaches, about 2 a month. So today what I'm going to do is I'm going to work on the trapezius, shoulder muscles, neck, and then I'm going to do my headache protocol. So, all right. So just remember to let me know if I'm going too hard, okay? We want hurts good. If anything just hurts, it's totally okay to say lighten up, okay? How's that pressure right there?
Good.
Just right, or can I go more?
Just right.
Just right. Okay, perfect. I'm going to try to maintain that pressure the whole time. So what I'm working here are the trapezius muscles. Secondarily to this, as I compress the trapezius muscle, I'm also pushing into the supraspinatus and some of the upper thoracic paraspinal musculature. And what I'm doing here primarily is just compression of the muscles, not really massage. This is just sustained compression. And what we're trying to do is stimulate the mechanoreceptors within the tissue that modulate muscle activity relative to sustained pressure. So as you can see, I've been holding this for a few seconds. Does that hurt good?
Yeah, very good.
It's always important to ask the patient how they're feeling. If the practitioner is going too hard, that's not helpful. But you want to be right in the middle where it kind of hurts and it kind of feels good. That's the therapeutic zone. So all I'm doing is moving an inch or two upwards after I compress each region for 5 to 10 seconds.
That's a little too hard.
A little too hard. How's that pressure?
That's good.
So the patient obviously indicated I was going too hard, so I lightened up. We want to stay in that hurts good zone. Very important to listen to the patient. If you're applying so much pressure that the patient tightens up and it's uncomfortable, it's not going to be helpful. You're not going to get them better. It's got to hurt good. Hurts good? Okay. You notice I asked that question many times. Very important to stay in communication with your patient. Okay. When I come into the mid-thoracic and the lower part of the trapezius muscle, I kind of like to roll it a little bit from medial to lateral. Again, trying to stay in that hurts good zone. Pressure's okay? So I'm working the left side now. Now I'm going to come over to the right side, do the exact same thing. How's that pressure?
A little too hard.
Okay, how's that?
Good.
Okay, again, paying attention to the patient and what kind of pressure I'm providing. We want to be right on that edge where it hurts good, and if I went any harder, it would hurt too much. We want to be just before it's that hurt too much state. Pressure's okay? She feels quite a bit tighter on the right side. I like to pull the arm back so that I can get in between the scapula and the spine. Pressure still good?
Mhm.
Okay. I keep asking her that because I feel like I'm actually doing a lot more pressure than I did on the left side. And again, I'm just slowly moving upwards, kind of at an angle in between the spine and the scapula, right on that curvature of the trapezius, from its attachment from the scapula up to the base of the skull. And these are all muscles, the upper thoracic and trapezius, that should be worked on when a patient comes in and has a headache issue. The trapezius muscles attach right to the base of the skull. Pressure still good?
Yep.
Okay. Hurts good?
Yeah.
Right on the edge?
A little bit over the edge.
A little too much? How's that right there?
Yeah.
So I was going a little too hard and I just back off, maybe 10%, 20%. Got to go right to that edge. Still okay?
Mhm.
Okay, so that's the pressure that I've applied, and myofascial therapy I've applied to the trapezius and upper thoracic muscles. Now I'm going to get in a little bit more to the supraspinatus, and I'm just using my thumbs, digging in there a little bit. How's that pressure? Just right? Okay. Hurts good?
Mhm.
I start on the lateral edge, and then I start moving a little bit more medial. Is anything radiating anywhere? Is it going up into the neck, down the arm?
Both.
Both, okay. So we're looking for the radiating, that referral sensation,
More in the neck.
more in the neck. So that's good. We want that referral pain to travel up the neck. It's probably following along its fascial attachments to the trapezius and its attachment at the base of the skull. Hurts good.
Mhm.
Staying in communication with the patient. Now I'm just going to kind of roll the muscle a little bit. There's a knot there, right at the medial angle of the scapula. It kind of feels like adhesions. It's kind of right where the attachment of the levator scapula goes right into the angle of the scapula. So I'm just going to kind of roll that a little bit. Hurts good?
Mhm.
Okay. Okay, now I'm going to come to the other side, the right side. Same thing, I'm starting laterally, right in this soft supraspinatus. How's that pressure right there?
Steady.
Okay. Just right?
Just right.
Okay. And then I'm going to move medially along the supraspinatus, probably affecting the trapezius here as well. She's a bit tighter on this side. Hurts good. And this is just, again, sustained compression. I'm not doing a lot of movement. We want to stimulate those mechanoreceptors within the tissues. Vibratory receptors, sustained compression receptors, tension and stretch receptors. Okay, I'm going to roll it a little bit here, right at that. So she said, ow. So that was an indication to me to lighten up. Got to listen to the patient. How's that pressure?
It's good.
Better. Okay, good. Very tight in here, right at the angle of the scapula, right where the levator attaches. Okay, I'm going to go back into the supraspinatus a little bit just because she's so tight on here, on this side. Now, I'm going to start working on the neck and the muscles at the base of the skull. So I'm just going to do a little kind of moderate pressured massage right on the cervical spinal musculature. No specific muscles, I'm just kind of moving over everything. How's that pressure?
Pretty good.
Good. And then I'm just going to make my way closer to the base of the skull, working my way up, trying to get these muscles to relax a little bit. Okay, and then now I'm going to go right into that insertion point at the base of the skull. Trapezius starts down here, comes up to here, and then attaches right to the base of the skull. All I'm going to do, again, sustained compression right at the base of the skull. How's that pressure right there? Is it radiating anywhere?
In the center.
Okay, good. Like center of your head?
Mm-hmm.
Okay. So again, when we're going to these muscles, we're trying to get that radiating sensation, and then I'll lighten up. Give her kind of a breather because it can kind of be intense. She's feeling it in the center of her head. Okay, I'm going to come a little bit more lateral on each side. Just pay attention to the location of my fingers. Where's that radiating to?
Still at the center.
Okay, still feeling it kind of in the center of her head. Hurts good.
Mm-hmm.
Okay, going further lateral. Where's that going?
On the side, on the temple.
Pardon me, say that again?
On the side.
The sides, like side of the head?
Yeah.
Okay. So now as I've moved a little bit lateral, she's feeling the referral pain sensation to the side of the head, probably in the temporalis area.
Mm-hmm.
And I'm hitting more of the splenius capitis now. So we went from trapezius to splenius capitis. And I'm going to just keep making my way laterally. Hurts good.
But more.
Press a little harder.
No.
Oh,
So
okay.
lighter.
Go a little lighter. Okay. How's that pressure?
It's fine.
Okay. So your fingers can get tired holding this pressure, so then I just go to 2 fingers instead of 1. And as I continue to move outwards, now I'm getting more to the attachment of the sternocleidomastoid, where it attaches. Radiating?
Mm-hmm.
Where?
Closer to ears.
Closer to the ears. She's feeling a radiating sensation near the ears. We need those radiating sensations. How about there?
That's very painful.
Okay, how about, is that better? So I was pressing with enough intensity that it hurt a lot, so I reduced my pressure probably about 30%. Where's it going?
Still closer to ears.
Okay, near the ears. So, how's that pressure?
That's fine.
Better, okay. So we're getting trapezius insertion, semispinalis capitis insertion, splenius capitis insertion, and sternocleidomastoid insertion. And I'm just going to keep making my way lateral. Where's that going?
Eyes.
Now she's feeling it in her eyes. Referral into the eyes. All that is just a fascial connection. Everything is connected. I'm literally pressing on the back of the head and she's feeling it in her eyes. And those are all those rectus muscles that are in the eyes that enable your eyes to move. Where's that going? Everywhere?
Yeah, ears.
Into the ears, okay. Another thing to pay attention to is the patient's movement, moans and groans, oohs, ahs. Those are all indications that you might be going too hard and you have to immediately lighten up. How's that pressure? Hurts good?
Mm-hmm.
Okay. I'm right below the mastoid. I'm pressing the muscles that are right below the mastoid. Okay. Now I'm kind of getting right into the TMJ.
Oh.
Ooh, okay, I went a little hard. How's that pressure? How's that? Okay, better. So real sensitive on her. Her TMJ is very sensitive. Where's it radiating?
Jaws.
Into the jaw. Okay. Okay, now I'm going to go along the ridge of the mandible, and I'm just going to press right onto it. How's that pressure? Where's it radiating?
Jaws and teeth.
Into the jaws and teeth, okay? Hurts good?
Mm-hmm.
Yes. Okay, and I'm just going to make my way down the ridge of the mandible. Where's that going? Jaws and teeth, referral. Okay, now I'm at the angle of the mandible. Where's that going?
Teeth.
Going into the teeth. Just pressing on the angle of the mandible. We're getting a little bit of the platysma muscle as I go over. Where's that going?
Forehead.
Okay, pressing on her jaw and it's going into her forehead. We want to find these referral spots. Okay, I'm way down at like the lower jaw, really on the platysma insertion now. Where's that going? Okay, she's not really feeling much there. Now I'm just going to come to the masseter on the side of the jaw. How's that pressure?
Oh.
Okay, I'll lighten up.
Mm-hmm.
How's that right there?
Mm-hmm.
Where's it going?
Everywhere.
Everywhere. It's going all through her head. Hurts good?
Mm-hmm.
That's a yes. There's some firmness in my pressure, but I'm relatively light because she's really sensitive.
Oh.
Okay. How's that pressure?
Mm-hmm.
Better?
Oh.
Okay. Where's it going?
Light. That's too much.
How's that?
Bad.
Right there?
Mm-hmm.
Okay. Where's it going?
Eyes and teeth.
Going into the eyes and the teeth. And I am just below and forward of her ear. Masseter, as I press harder, there is a pterygoid insertion that's not far from there. There's auriculus muscles, multiple, that are in this general vicinity. Where's that going?
Teeth.
Going into the teeth. Okay. Just forward of the ear here.
Oh.
How's that pressure?
Midnight.
Okay, how about there? Good. Where's it going?
Center.
Center of the head. So again, we're looking for referral, kind of radiating. It's not tingling and numbness. It's just a sensation that they feel in various places throughout their head. In her case, she's literally feeling this kind of like in the center of her head, the center of her brain. And it's a tension release sensation. Now I'm going to come to the temporalis and I'm just going to press. How's that pressure?
Okay.
What are you feeling where?
That feels good.
Feels good. Kind of all over or in a certain space?
Everywhere.
Everywhere. This is going everywhere. Okay, and then I thumbs to the top of the head. Where's that going?
Ow.
Okay, sorry. A little lighter. How's that pressure? Where's it going?
Everywhere.
Going everywhere. A tension release sensation. All right, Priya, turn over on your back. So that was all the muscles on the back of the head. Now we're going to work front of the face and jaw. Okay, relax there. Doing okay?
Mm-hmm.
Okay. So now I'm going to apply pressure to muscles in the jaw, the masseter again. Where's that going?
Jaws.
Where's that going?
Teeth.
Teeth.
Oof.
Okay. How's that better?
Mm-hmm.
Where's that going?
Teeth.
Into the teeth. Probably. Where's that going?
Partially eyes and partially jaws.
Partially eyes, partially jaw. I'm right at that zygomatic arch where the masseter and pterygoid muscles are. Where's that going?
Eyes and ears.
Eyes and ears.
Ears.
All these places where she feels the headaches. How many times have you had a headache and felt it in your eyes?
All the time.
Okay. Just forward of the ears here. Where are you feeling it?
Jaws.
Good. Okay, I'm going to come to the temporalis again. How's that pressure? Hurts good?
Mm-hmm.
Okay, now I'm going to come to some of these facial muscles. Just right to the sides of the mouth. Just press in there with not too much pressure. How's that pressure? Too hard? How's that right there? So I reduced my pressure by about 30-40%. Where's it going?
Teeth.
Okay. Slightly above the lips and to the sides of the nose. Just applying straight pressure down. Where's it going?
Teeth and jaws.
Okay. Just below the eyes, right next to the nose. Where's it going?
Nose.
Nose, okay. Coming right into the temple. Okay, lighten up. Where's it going?
Center. Forehead.
Center of the forehead. Here, I'll lighten up a little bit. Is that better?
Mm-hmm.
Hurts good. Okay, and then I'm going to just come right up here, right inside the eyebrows, press straight down. Where's that going? Nowhere? Okay. Anything there?
Mm-hmm.
Yes?
No.
No. Okay, right on the forehead. Anything?
Mm-hmm.
Okay. So that's it with the soft tissue work. Now I'm going to adjust her cervical spine. All right, Priya. Lift your head up. There you go. Relax. Let's take a look here. Okay. And we just want to mobilize the cervical spine. Relax your head in the pillow. Little movement. There we go. Same thing over here. Little movement. Good. Okay, go face down. And then we're going to get the mid-thoracic. Let your arms hang down. Okay. Big deep breath and breathe out. And really relax. Breathe out. There you go. Okay. You're tightening up. Big deep breath and breathe out. Really relax your shoulders. I won't push too hard. Really relax. Breathe out. Come on, breathe out. There we go. Okay. You're a little tight. You're holding a lot of tension, okay? So really try to relax when you breathe out. One more push. Okay. Can't push too hard on her. She's really tight. Let me get the ribs here. Breathe out. There we go. Good, good. You okay?
Yeah.
Big deep breath and breathe out. Really relax. Okay, that's it. All right, we're done.